Naija Senate on Wednesday don take one big step to better healthcare money matter for Naija as dem pass the bill wey wan amend the National Health Act No. 8 of 2014 go second reading. Dis bill wey Senator Bani Gohari from Rivers West sponsor dey try increase the basic healthcare provision fund from 1% to 2% from Federal Government Consolidation Revenue Fund to make the country health system strong wella. As e dey lead the talk on top the general idea of the bill, Senator Bani Gohari wey be chairman of Senate Committee on Tertiary Health talk say even though the health matter dey plenty and donor help dey reduce, the money wey dem dey put still no reach to take care of Naija people.
It represents Nigeria's first statutory mechanism for sustaining health financing. However, with increasing service demand, stagnating donor assistance, and persistently high out-of-pocket expenditure, now over 75% of total health expenditure, according to the National Health Account of 2022. The 1% allocation has proven insufficient to meet national health needs. Recent fiscal threats further underscore this concern. The withdrawal of the US government support in key health programs and Nigeria's approaching transition from Gavi, the Vaccine Alliance, mean that the country will soon shoulder greater financial responsibility for immunization, maternal health, and disease control. Without an increase in domestic financing, these developments could erode the hard-won gains in child survival, epidemic preparedness, and universal access to basic health care. Therefore, increasing the basic health care provision fund from 1% to 2% of the Consolidated Revenue Fund is a strategic and timely intervention.
As dem support the bill, other lawmakers tok say National Health Insurance Fund dey struggle to close the gap wey dey for important areas like immunization, mama-pikin healthcare, and disease control.
This will enhance our primary healthcare system, encourage universal health coverage. Mr. President, health is too serious to be left to Nigerians, especially in the face of poverty. In a lot of the developed and developing world, especially the developed world, I know in Canada, healthcare is essentially a government thing. You hardly find private hospitals. That shows you that this sector, this area, is too important to be left to the individuals, especially in poor countries like Nigeria. Mr. President, today, we have a situation where citizens and our constituents resort to quacks, resort to prayer houses. Mr. President, I want to also say clearly that I believe in the efficacy of prayers, but in what is happening today, our people are driven out of poverty to these prayer houses in issues that can be handled, especially at the primary healthcare level.
I stand to wholeheartedly support the second reading of this important bill. I look through, and my first observation is that the chairman of Health Committee is not asking for more money. What he's asking for, really, is that greater attention should be given to preventive aspect of our health system. And like he rightly couched it, he said, this is where mothers give birth, children are immunized, and diseases are detected at an early time. My feel is that if we take care of preventive aspects of our health system, we spend less money on the curative side. If we take care of the preventive side of our health system, what it means is that our population will be healthier and their productivity our contribution to economic prosperity will be greater.
Supporting this bill against the background of the fact that the United States of America has drastically reduced their funding, aid funding in the health sector. And there is also donor fatigue amongst other international organizations, international aid agencies that normally support all this HIV, malaria, tuberculosis, and what have you. There is donor fatigue. And the United States, under President Donald Trump, has withdrawn support for all these health-related endeavors. So against this background, there is need for us to increase our funding from 1% to 2% for the health sector.
Senate President Godswill Akpabio can carry the bill go give Senate Committee on Health, Tertiary and Secondary, make them do some work on them, and make them bring reports come back within 4 weeks.
Distinguished colleagues, a bill for an act to amend the National Health Act number 8, 2014 to increase the basic health care provision fund from 1% to 2% of the Consolidated Revenue Fund and for related matters 2025, second reading taken. This bill is referred to the Committee on Health, Secondary and Tertiary to report back to the Senate within 4 weeks.
Make una no forget, say, as we see am, na so we dey talk am. We know they take blame. Or he fame or not, TMC News.